Myocardial infarction, or MI. What is it?
Hi, Mr. Jones. How are you?
I'm doing good, thank you.
Great. Now, let's see. It's been about a month since you were in the hospital with the heart attack and we put in that coronary stent. How are you feeling?
1 month ago, Mr. Jones woke up in the middle of the night with severe crushing pressure behind his breastbone. He previously had been well, but he has a medical history of high blood pressure, high cholesterol levels, and he's a smoker. Mr. Jones suffered a heart attack. In medical terms, he suffered a myocardial infarction, or MI. The word myo means muscle, and cardio is from the Greek word cardia, which means heart. So myocardial means heart muscle. The heart requires extensive amounts of oxygen-rich blood to function and to survive. A myocardial infarction, from the Latin word infarctus, is the irreversible damage of the heart muscle that occurs when the heart is deprived of oxygen. The term to describe myocardial tissue death is cardiac necrosis, from the Greek word for death. Necrosis is the result of not enough blood flowing to the heart muscle tissue. During an MI, there's a decrease in blood supply to the heart, which is commonly referred to as ischemia. Ischemia is caused by constriction or blockage of coronary blood vessels. The term used to describe constriction and blockage of the coronary blood vessels is atherosclerosis. The most common cause for MI is the buildup of plaque in the coronary arteries. Let's take a look at what happened to Mr. Jones last month. His problem started in one of his coronary arteries, the left anterior descending, known as the LAD. Atherosclerosis is the term used to describe the buildup in the inner lining of his coronary arteries. The buildup is a compilation of several substances such as fat, cholesterol, clotting material, and other cellular waste products. The resultant buildup of these materials is called plaque. Plaque is dangerous because it may partially or totally block the blood's flow through an artery if a piece of the plaque breaks off, or if a blood clot or thrombus forms on the plaque surface. While Mr. Jones' plaque buildup has been going on for some time, it was a month ago that the coronary artery became fully blocked. If blood flow to the myocardium is not restored, the damage becomes irreversible. What is the area of decreased blood supply called? That's right, ischemia. During a myocardial infarction, there is a decrease in blood supply to the heart. Ischemia is caused by constriction or blockage of the coronary blood vessels. It might help to think of a pebble dropped into the lake as you think about the rippling effect of myocardial ischemia that is sustained and ultimately leads to tissue death. The rippling effect of the pebble is similar to the rippling area of ischemia because it has the potential of growing and extending if oxygen is not restored to the myocardium. What is the name of the irreversible damage of the heart muscle that occurs when the heart is deprived of oxygen? Infarction is correct. That's right, the circled area is the infarcted area. What's the term to describe myocardial tissue death? That's right, myocardial necrosis is the result of an imbalance in the supply and demand of oxygen to the heart. Once a myocardial infarction occurs, the goal of treatment and care is to limit the size of the infarct and restore the heart to its highest level of possible function. Persons suffering a myocardial infarction are at an increased risk for mortality and morbidity. There are known factors that increase your risk of developing an MI. These risk factors are divided into two categories. Modifiable risk factors can be controlled or minimized through a combination of lifestyle changes and treatments, and non-modifiable risk factors are risk factors that cannot be changed. Let's take a look at Mr. Jones' risk factors, beginning with the modifiable ones. Mr. Jones is a smoker. Mr. Jones has a very stressful job and much stress in his life. Mr. Jones sits at a desk for work and he gets little physical activity, leading a very sedentary lifestyle. Mr. Jones has high blood pressure. Mr. Jones also has high cholesterol levels. The good news is Mr. Jones is not obese, which is another modifiable risk factors for patients at risk of developing a myocardial infarction. Another modifiable risk factor is type 2 diabetes. Type 2 diabetes is considered a modifiable because it often occurs in individuals who have other risk factors such as obesity, high cholesterol levels, high blood pressure, or who are physically inactive. The risk of developing type 2 diabetes also increases as people grow older. Although diabetes can't always be cured, controlling other risk factors certainly improves your chances for reducing the risk of type 2 diabetes. Some risk factors for myocardial infarction are not modifiable, like type 1 diabetes, age, and a gift from your parents, your genetics based on family history. Aggressive secondary prevention via pharmaceutical interventions is pursued to lower patients' risk for recurrent cardiac events and subsequent mortality. The 2013 American College of Cardiology Foundation and the American Heart Association have guidelines for the management of acute myocardial infarction, which outline 5 evidence-based pharmaceutical interventions that should be prescribed at hospital discharge for patients who've experienced a myocardial infarction. These medications include antiplatelet, anticoagulant therapies, beta blockers, renin and angiotensin-aldosterone inhibitors, and lipid-lowering statins. For some patients, diuretics are also prescribed. One strategy is to prevent or break up blood clots in blood vessels using antiplatelet and anticoagulant medications. Another is to reduce how hard the heart works, to reduce the heart's force that pushes blood through the body using a drug known as a beta blocker. Yet another strategy is to relax blood vessels using angiotensin-converting and aldosterone inhibitor medications. Interventions are also aimed at reducing cholesterol, to reduce cholesterol-containing plaques in the blood using lipid-lowering statins. And finally, for some patients, blood volume is reduced using diuretics. Management of a patient surviving a myocardial infarction is complex and involves modifications in the patient's lifestyle as well as medical treatment strategies for improving demands on the heart. Treatment strategies include the use of combinations of medications, making it important that care providers are well versed as to how and why these treatments work or may not be working. Better understanding by the provider will assist in answering common patient questions about treatment option effectiveness. One of the most common strategies to reduce the work of the heart in patients surviving myocardial infarction involves reducing myocardial oxygen demands of the heart, as well as preventing abnormal rhythms or dysrhythmias. When supply of oxygen cannot meet the demands of the working heart, the heart is at risk of becoming ischemic, and we know that unresolved ischemia can lead to infarction. In order to better understand how myocardial oxygen supply and demand contribute to myocardial ischemia and infarction in a patient like Mr. Jones who experienced an MI, please proceed to the next video in this series titled The Myocardial Oxygen Supply and Demand.